Hi, my name is Dr. Victor Ngani, and I'm a critical care doctor and as well as the medical director at RFH Specialist Hospital in Nairobi, Kenya. And I want to talk about two things that have become quite commonplace and not commonplace really, but common speak in our vocabulary recently as a result of COVID-19. And the two things we are discussing are masks, basically. And principally the two types of masks that healthcare workers use. The first is a surgical mask, and the second is what is called the N95 mask or a respirator. And I just want to highlight key differences, when this should be used, who should use them, and what the benefits are in view of COVID-19. And COVID-19 is fairly new, so this information keeps changing from time to time. Initially, we felt it was principally droplet infection, meaning that when someone sneezes or coughs, then whatever is contained in the droplets in the air, that's what can then land into your mouth, into your mucosa, and cause an infection. But lately we've been thinking that perhaps beyond droplet infection, there's something called aerosolization. Aerosolization means that basically it's almost like a spray, a mist in the air that can last for hours. The suggestions, it can last for up to 8 hours in the environment. So essentially, masks are part of what we call PPE, personal protective equipment, that basically limit the spread of infection from person to person. Others, things like gloves, you can talk about goggles, and a couple of other things, including the hood and the overall that we are aware of. But back to something that the public has sort of felt the need to use, and the masks. I'll start with surgical mask. Now, the key thing about masks is not just the concept of being some form of barrier in front of your face, but that it can filter, and they have different standards. In fact, the concept of N95, we'll see that N95 is a standard as opposed to the name of a mask per se. And the surgical mask would filter certain items, but not entirely bacteria and fungi. And the role of the surgical mask is actually to protect the person on the other end, not the person wearing it. That's by and large the source. So you'll see surgeons wearing masks, and the idea is to ensure that when they breathe, or if they want to sneeze or to cough, then whatever they're doing doesn't get to the patient. So that's the principal thing. And so in the context of COVID-19, then what we're saying is that this mask would stop if you're coughing, and if you have COVID or possibly have COVID, and you put on this mask, then there's a reduced chance that anything, droplets, will leave your personal space and spread far. And that's the single most important benefit of this. And this is why you'll hear recommendations suggesting that if you are coughing, or you have COVID-like symptoms, or you have COVID in the public areas, you should wear a mask. The reason why it doesn't protect someone as well, when I talk about potential victims, someone who doesn't have COVID, then what it means is there's a space. If I attach this to my face, it attaches fairly loosely, and there'll be spaces up here. There's going to be a space here. There's going to be a space at the bottom. Plus, the filtration isn't as good. And so, if you're talking about an aerosolized infection, something that can stick in the air for a while, then all these spaces are avenues through which you can get an infection. One benefit, however, is if there's a direct splash or direct cough, then that can be caught on the mask, and it doesn't really get to you directly. And to that extent, there could be a slight benefit if in close proximity to somebody, for example, who has COVID. And this is why then you hear of this recommendation that if you're taking care of a person who has COVID but is not able to wear a mask, then you as the person taking care of them should wear a mask, because you'll be in close proximity to them. If they're to sneeze or to cough, then suddenly, if you have this on, then certainly direct light droplets getting to you is limited. So splashes, like droplets, this is what this is for. And otherwise, you put it on when you have a cough and cold. I'll come to a public health issue, what could be considered in normal circumstances. This, on the other hand, is the N95 respirator, or the N95 mask. N95 is a standard, as I've said, and what it means is that it can filter 95% of the small particles, including bacteria and fungi, and that's really fantastic. And this particular one has this small device here, and this is actually just a valve. You see, when it's supposed to be a very tight fit around the face, and in fact, one thing that must be done with the N95 mask is to have a fit test done. A fit test to ensure, those are my children talking out in there. I have to take a pause. Ariana and Tello, guys, you're making noise. And I feel like you make much of making a video. So that is that. The second mask we're going to look at is the N95. As I've said, an N95 is a standard, not really the name of the mask itself. They're different manufacturers the same. And N95 means that it filters 95% of the small particles, including viruses and fungi. And that's really a good thing. Now this particular N95 has something that you don't have, doesn't have to be there in all the masks, and this is this device here. This is actually a valve. You see, the N95 mask is meant to fit more snugly onto the face. And in fact, there is no one size fits all. You're supposed to do something called a fit test to see how well it closes around your nose. So essentially there'll be a fit testing being done. If you take the wrong size of a mask, it won't protect you as much, really, because there'll be some spaces and so on. So a fitting mask really sort of constricts you, and the air inside here, I mean, you'll feel a little bit as if you're struggling to breathe in some instances. And so having this valve allows air to come out easily, and so you don't have a build-up of air, or that what you're trying to exhale, carbon dioxide, doesn't quite build up out here as you would expect. And so my view is this is actually a better one, a better mask for protecting the person who does not have, and this is why it's recommended for healthcare workers. This is the N95 mask that should then be used. And there's a process for wearing it and also taking it off. We'll probably not go through that because it's not really important, but essentially you put it on your face, the straps will go at the back, and you'll have a very in the initial state, you take the lower one, take it all the way back, upper one, take it all the way back, and sort of it fits nicely. So that's the N95. Different sizes, just check if it fits nicely. Now there's a metallic strip here. Fix it on the nose so that it fits very nicely, and also on the surgical mask there is this part that fits nicely. Summary: surgical mask is essentially to protect those around you. If you're coughing, if you have COVID-like symptoms, you don't want to spread the virus, then you go ahead and use this in case you sneeze, in case you cough, even just your breath doesn't allow droplets to travel far, limiting spread of infection. Secondly, a direct cough, large droplets being splattered onto your face, this mask can protect you in that way. If you're in close proximity to somebody who's coughing, who could potentially have COVID, or if you're taking care of somebody who has COVID but is not able to wear a mask and you don't have an N95, then this is what you want to use. For healthcare workers, anybody else who's in a state where COVID-19 could be present in large quantities, the SARS-CoV-2 virus could be there in large quantities, and what you want to do is to wear this, and this is essentially the standard for healthcare workers, and every single healthcare worker who's taking care of COVID patients should essentially be wearing this kind of a mask. Now, normally this mask costs about 3 Kenya shillings, 3 to 4 Kenya shillings, which means that for $1 you could get about 30 of these, and this would go for between $1 and $3, $1, $3, actually, maybe slightly more than $1, maybe 1.5 to $3. But in this COVID era, we have what we call the COVID profiteers, the corona profiteers, pandemic profiteers, really. And so this mask, I've had, believe it or not, a price quotation. Instead of 3 shillings, it's being sold for 120 shillings, meaning instead of getting 30 for $1, you're getting 1 for $1, making it really impossible to use. And this mask, if you're lucky to get it now for $10, that's such a bargain, because people could be selling it as much as $3 and it's just not there. And what that does is it makes it impossible for healthcare workers to get the protection that they need. And just yesterday I was reading a story where a healthcare worker declined to take care of a patient who had COVID-like symptoms because he didn't have this. Now, it's hard to blame the person because maybe it's not COVID, maybe it's something else, but it's hard to blame them because you put yourself at risk, and because you took care of one patient without taking care of yourself, then the next time the country needs you won't be there because you'll probably be in quarantine or unwell. And so an appeal I would make to the vendors of masks really is to consider keeping their prices low, because this is one place where you can make a lot of money now by volume, not by price. If you price it as you have, yes, you'll make a lot of money right now, but in the process you make stopping this pandemic very, very difficult, and this is a real problem we are facing as healthcare workers. And so my appeal to suppliers, please consider keeping the prices where they are within reach. Essentially, I should use this not more, change it at least once a day. In fact, normally it's supposed to be after every patient encounter. No chance you're doing that, but at least once a day to change this. Now we are already moving this to about a week for those who have it, and even then we don't have a replacement. And what that does is it means that there's a risk I can transmit the infection to the next patient, or I as a healthcare worker would get sick for not using this mask properly. And this problem comes down to excessive pricing of these life-saving devices. I spoke about a possible healthcare issue, public health issue. Theoretically, and this is highly theoretical, we may not have enough supplies. If this cost 3 shillings, then even in a resource limited